As you have seen in the video of the GlycoCheck system, with the camera of the GlycoCheck system, we capture the live motion of red cells through all the microvessels in the sublingual tissue. And the GlycoCheck software automatically identifies all the vessels in these quality controlled videos. So along the length of all the vessels in the videos, we define so-called measurement sites. So one measurement site is one of these cross lines. One measurement site is just a short length of a microvessel of approximately 10 microns long. And then within each measurement site, we measure the flow of our blood cells through these microvessels, and we also measure the dimension of all these vessels. So with automatically identifying all the vessels, we can determine the number of true capillaries and see how these numbers change over time when an individual is exposed to risk factors. And one of the most recent findings that we did with the GlycoCheck system is if you zoom in on the true capillaries, so those are the blood vessels with the smallest diameters of 4, 5, and 6 microns in diameter, so small that individual red cells have to be deformed and flow through one by one, or else they wouldn't fit into these small capillaries. If we count the number of smallest capillaries, do that, let's say, in a healthy individual, as shown on top, compared to a person that is exposed to risk factors and is experiencing some early or late damage to his microvascular system, one of the key findings is that the numbers of capillaries significantly drop in an individual that is exposed to risk. So on top, you can see on the resting conditions, so low blood flow conditions, in this example, 2 capillaries are being perfused with red cells, and at similar or even lower blood flow levels in an individual that has a compromised microvascular system, you will see that fewer capillaries are being perfused under resting conditions. So in a recent study, close to 1,000 people, healthy individuals in an obesity study, we classified all these individuals based on their cardiovascular risk, the so-called Framingham risk score. So compared to low risk, we looked at people with medium risk, so that is between 10 and 20% risk of a cardiovascular event in the next 10 years, and also a group with high risk, so more than 20% risk of a cardiovascular event in the next 10 years. And the risk is determined, for instance, by body size, aging, other risk factors like smoking or blood glucose levels or hypertension. And then comparing with the low risk group, we noticed that if you zoom in on the smallest capillary, so from left to right, these are the 4 up to 10 micron microvessels, that compared with a low risk healthy group, then the medium risk and the high risk subgroups already show a loss of 30 up to 50% of their smallest capillaries. So this is a recent finding that was published this year, a couple of weeks ago, that already at this early stage in healthy individuals, before diseases start developing, assessing the microvasculature with the GlycoCheck system already allows you to identify these early changes, the early loss in the numbers of smallest capillaries. Another example is shown here. This is comparing the number of smallest capillaries here on the left between young healthy controls, which is set at 100%, and then older healthy controls, which still show under resting conditions a normal level of capillaries, compared with people with early type 2 diabetes. So these people are shown in the red line, still healthy, showing no organ complications yet, but still suffering from type 2 diabetes, show already at this early stage, compared to young healthy controls, about a 70 to 80% loss of their smallest microvessels. Well, similarly, and even more dramatic, is another recent study that we did with the GlycoCheck system in people with COVID-19. So we looked at 2 groups of COVID-19 patients. So in the dark red are the most seriously ill COVID-19 patients that are put on a mechanical ventilator in the ICU. And then the yellow or orange ones are COVID patients that are doing a little bit better and can breathe on their own and don't need the mechanical ventilator. And in line with the other data on the people in the obesity study and with diabetes, we find that the most critically ill COVID patients, they show even more striking losses of their numbers of smallest capillaries. So compared to healthy controls, the COVID patients show up to 95% loss of their smallest capillaries. which makes sense if you look at all the complications that these patients are getting. So losing 95% of your capillaries means that all your organs are at great risk of being damaged. This happens all over in your body. So in your kidney, in your brain, in your heart, in your lungs, all these organs are extremely vulnerable because losing all these capillaries prevents you from delivering the required nutrients and oxygen to the tissue cells, and also prevents you from removing all the waste from these tissues out of the organs back into the circulation.